Thank you, Honorable Speaker. Greetings to the Deputy Speaker and the Speaker of the Legislature, Honorable Boyce. Greetings to the Honorable Premier of KwaZulu-Natal, Honorable Sihle Zikalala. And greetings to the Provincial Legislature and all the honorable members. The Chairperson for Social Development as well, and the Portfolio Committee, and all distinguished guests. Honorable Chair, today I rise to table the Special Adjusted Budget for Social Development, which is Vote 13. It is just more than 3 months down the line when I stood before the House to present the budget speech to meet the needs of the communities that we serve. The stark reminder by the Honorable Premier, Mr. Sihle Zikalala, who during the State of the Province address earlier in this year, reminded us that, and I quote, social development is a critical pillar in the building of a united, non-racial, non-sexist and prosperous society, close quotes, still remains very relevant even today. Honorable Chair, the horrendous increase of the gender-based, Honorable Chair, just allow me to express my gratitude first to all of our frontline workers and partners in the NPO sector who have been at the forefront in the fight against coronavirus. This is the true spirit of Tumamina. We appreciate their commitment and sacrifice. Due to this pandemic, as the department, we have lost, among others, senior managers, Mrs. Gabsile Skakane, Acting Chief Director, Research and Development, and Mr. Derek Msimang, Acting Chief Director for the Midlands Cluster. These are our foot soldiers who died with their boots on. From March 2020, the department suspended some of the operations to comply with the applicable alert level of the nationwide lockdown regulations. Since the introduction of the alert level 2 of the nationwide lockdown on the 18th August 2020, the department is increasingly reopening services that were suspended, of course, in line with the applicable regulations. The outbreak of the COVID-19 pandemic and the resultant nationwide lockdown has had a significant impact on the finances of the government. This happens against the backdrop of the economic decline which the country is experiencing. The budget cuts and reductions in our budget amount to 64 million rands of our equitable share. Further cuts in our budget are as a result of internal reprioritization to fund social relief of distress and the homeless people. Honorable Chair and honorable members, the horrendous increase of the gender-based violence and femicide incidents during the national lockdown are of great concern to us. The incidents of abuse, rape, and murder of women, children, and older persons indicate that as society we are losing, as the society, we are losing our hold on what exactly the moral fiber. The incidents in Umzumbe, for an example, highlight the need to think differently to confront this scourge head-on. As the department, we are not immune in the incidents of gender-based violence. In the past weeks, we have also lost some of our own, our foot soldiers, tasked with the responsibility to provide support to the victims of this scourge. We would like to pay our respect to the fallen social workers by the names of Ms. Hlengiwe Makhathini, who was attacked and shot to death with a nail of bullets in her room and at Madlazini, and Ms. Hloniphile Hadebe, who was stabbed to death at her home in Molweni by a man. As a response, the department provides social services such as psychosocial support to victims and families, as well as assistance to get health care and legal services, among others. Victims continue to be taken into our shelters, whose exact location would never be revealed. As part of our ongoing safety, all district champions launched the campaign of the Provincial Integrated Plan of Action in November 2019 to fight the scourge of women and children abuse in their respective districts. This is a call for us as government and all other stakeholders to double our efforts to deal with the scourge which has become a nightmare in our communities. As this province, we employed social workers, Honorable Chair, 183. As we were confronted by the scourge of gender-based violence and femicide. This team is already in our communities having a dedicated focus on prevention, victim empowerment, and trauma management. Furthermore, we have decided to employ more additional social workers, 30 of them, and these are allocated to hotspot areas. Madam Speaker, recently we launched the Boys Assembly, an initiative to encourage parents to raise the girl child and the boy child as equals. It is also ensuring that boys find time to talk with a neutral person about all issues affecting them. As much as we know that social workers frequently visit our schools to help learners with psychosocial support and behavioral change programs, we want to further strengthen our partnership with the Department of Education to deal with bullying in schools. It is our major concern. As we all know, bullying is a different form of violence. Therefore, we want children to be alert at young age about dangers. As the department, our commitment is to ensure that we protect our children from incidents similar to the one that we have seen in Zululand, where 2 learners were attacking another one. Both departments, Education and Social Development, we are going to work hand in glove in eradicating this scourge. The department is developing a clear program to deal with discrimination and denunciation of lesbian, gay, bisexual, transgender communities. They should enjoy equal rights as enshrined in the Constitution of the Republic of South Africa. Under Social Welfare Services, Program 2, let me remind honorable members that transformed developmental social welfare is one of the intended government outcomes outlined in the medium-term strategic framework of 2019 to 2024. As I indicated earlier on, the department experienced budget cuts, budget reductions, and reprioritization to fund COVID-19 priorities. As a result of internal budget reductions and reprioritization, the 2020 to 2021 budget allocation for social welfare services, Program 2, has been increased 145 million rands, which makes it go from 823 million rands to 968 million rands. The adjusted budget for Program 2. Under services to older persons, which is allocated 171,864 million rands, the budget allocation for services to older persons has been reduced by 17 million rands, which resulted to 189 million rands to 171 million rands. The budget cut is in relation to savings realized against transfers and subsidies to non-profit institutions, whereby transfers were not made to institutions which were not operational as a result of the nationwide lockdown. Only minimal transfers to cover the administrative costs of institutions were made, as there was no attendance by beneficiaries. As mandated by the Constitution of the Republic of South Africa and the Older Persons Act 13 of 2006, the department will continue to provide care and support services to older persons. Under the services to persons with disabilities, the budget allocation for services to persons with disability has been reduced as well by 3 million rands. From 157 then to 153. This reduction is as a result of savings caused by minimal transfers to NPOs to cover the administrative cost, as there was no attendance of beneficiaries during the nationwide lockdown. The department will continue to implement the white paper on the rights of persons with disabilities 2015. Under HIV and AIDS program, the budget allocation for the HIV and AIDS sub-program has been reduced by 11 million from 232.8 million to 221 0.8 million. The reduction is as a result of the reasons stated above. Social behavioral change programs that were suspended due to lockdown regulations will be resumed, thus expanding the scope beyond schools to communities. Under the leadership of the Honorable Premier, Mr. Sihle Zikalala, we launched the Government to Government in July 2020. This initiative is a partnership between South African government and United States Agency for International Development. It is meant to support the implementation of YOLO, which means you only live once, and CHOMI programs, which are behavioral change programs, which aim to upscale the implementation of primary prevention of sexual violence and HIV and AIDS among 10 to 14 years and 15 to 25 years old. Under social relief of distress, the 2020 to 2021 budget allocation for the SRD sub-program was increased by 197 million rands from 17.7 million. As of now, it is to 214 million rands as a result of internal budget reprioritization and repurposing. Before the outbreak of COVID-19 and the lockdown, the sub-program had an allocation of 17.7 million. Because of the huge demands for SRD as a result of increased level of unemployment and poverty, we had to identify savings in our budget in order to respond to the needs and demands from our destitute communities. And this reprioritization and repurposing was made within our budget as the department. Honorable members will recall that as some of the social development services were limited due to the lockdown regulations, and the SRD became one of the department's main interventions to cushion the poor and the vulnerable against the severe impact of COVID-19 and lockdown. I must mention that the department has experienced some challenges with the provision of SRD. These include capacity of service providers in the form of non-profit organizations to deliver to eligible beneficiaries. Some of these challenges have been raised by the public, members of the DSD Portfolio Committee. However, I want to give assurance that all these challenges are being addressed and the distribution of SRD will improve in the next few weeks and beyond. The new measures to improve our capacity to deliver SRD include the hybrid model, which means that we will distribute food parcels and food vouchers. We will also strengthen our NEV center. In fact, we have started to strengthen our NEV center to coordinate the overall distribution. Since the nationwide lockdown was implemented, we have been working with reduced staff complement in order to observe physical distancing. We have since recalled them. Within the COVID-19 regulations, all our staff will come back to speed up the progress of SRD as we are mandated as this department. Under Children and Families, Program 3, the budget of 2020 to 2021 budget allocation for this one has been reduced with 111.7 million. Thus, it gives it remains 1.7 billion, 1.7 million to 1.9. Pardon me. It's 1.7 billion to 1.6.9 billion. The main reason for the decrease is to find the departments responsive to the COVID-19 pandemic, such as the provision of the SRD to destitute communities and shelter to the homeless. The budget for Program 3, sub-program, has been readjusted as follows. Under care and support services, the budget for this program has been reduced by 1.5 million. from 1.056 million, it goes to 14.1 million to 13.1. The reduction is mentioned from savings to fund the COVID-19 reason. We remain persuaded that a family is a building block of a society, and that functional families contribute to societal stability. To this end, the department will increasingly resume care and support services to families to promote social cohesion and social capital. Under Child Care and Protection program, the care and support services to families budget has been reduced by 64.2 million, giving us 486.8 million to 422.6 million. The Department of Official launched and commemorated the 2020 Child Protection Week under the theme, let us all protect children during COVID-19 and beyond. During the lockdown, we continued to collaborate with relevant NPOs in managing cases of child abuse, neglect, and exploitation, and monitoring the movement of children in line with lockdown regulation. We will continue with such initiatives. Under sub-program Early Childhood Development and Partial Care, the budget for ECD and partial care sub-program has been decreased by 28.7 million rands, from 708 to 680 million rands. The department is currently collaborating with all relevant stakeholders to prepare for the reopening of ECD centers, which were closed during the lockdown levels 5, 4, and 3. Through the ECD conditional grants, 295 additional ECD centers will be funded, while 12,480 children will be subsidized. A total of 605 unregistered ECD centers will be supported through the procurement of personal protective equipment from this ECD infrastructure grant component, which has since been repurposed, as there will be no maintenance of ECD centers as the result of the pandemic during this financial year. Honorable Chair, furthermore, in July, we launched Ivangasali ECD campaign in partnership with the Nelson Mandela Foundation to ensure that unregistered ECD centers within the province of KwaZulu-Natal are supported to comply with the norms and standards for registration as partial care facilities. As a result, a total of 3,105 unregistered ECDs have come out for assistance to get registered through this campaign. Under the Alternative Care Child and Youth Care Centers, the budget for the Child and Youth Care Centers sub-program has been reduced as well by 6.6 million rands. It moves from 241 million to 234.3 million rands. The CYCCs were fully operational during the different alert levels of the national worldwide level. Under community-based care and support services for children, the budget for the community-based care and support services for children sub-program has been reduced by 6.6 million rands. It goes from 124 million to 117 million rands. Most of the community-based care and support services for children were suspended during the alert level 5 and 4 and 3 of the lockdown. In level 2 of the lockdown, the department resumed these services in a phased approach. We are facilitating the finalization of the mentorship program for learners who have completed their child and youth care learnership. And under the program 4, restorative services, honorable members, restorative services will continue to play a key role towards the achievement of national priority. Priority 6, social cohesion and safe communities. Then the budget allocated is 405, it moves, the budget cut is 26 million point 9. It goes to 405 to 374. The main reason for the decrease is to fund the department's response to COVID-19 pandemic, as said. With a total of under social distress of destitute communities, a total 19 million has been moved from Program 4 to Program 2. The remaining 3.5 million was cut across all sub-programs in respect of transfers. A further reduction of 7.5 was cut across all restorative services sub-program. The department remains committed to the plight of homeless people in the province. In response to this, the department is currently coordinating the developmental of the intersectoral to address the growing number of homeless people. Our focus is on rehabilitation, reintegration, and skills development services to improve the social well-being of homeless people and their ability to be resilient and independent. To this end, we have been able to reunify 488 young people who were living in the streets with their families. 39 of them, of the young people, have been committed to treatment care centers for drug abuse, and 84 will be enrolled in the youth development academies. We also appreciate the role played by local government, which is highlighted by the Newcastle municipality employing some of the homeless people from our shelters. Equally, the role that has been played by eThekwini municipality and general members of the public to help the UNISA homeless student is noted. The budget allocations for the following program is crime prevention and support, which is budgeted 136.2 million rands, and the budget is cut by 12.9 million rands. Under the victim empowerment program, which is budgeted 84 million rands, the budget has been reduced by 4.6 million rands. Honorable members, recent reports suggest that gender-based violence has increased since the beginning of the nationwide lockdown. The murder of a number of women in Mtwalume area, or the area of Ugu district, as well as in Herikwala, Umgungundlevo and Utugela district, has left the province reeling. The department has been working with other government departments to mobilize sectors of the society in the fight of the scourge of gender-based violence and femicide. Since August 2020, we have established a strong partnership with the leadership of Santako in the province with the launch of educational message in Umzumbe, in Nanda, Pinetown, Chatsworth, and the Turkin CPD. Let us appreciate the work done in partnership with whilst we are led by the Honorable Premier, in partnership with other departments, in ensuring that taxi owners and drivers, rank marshals, commuters play a crucial role in the fight of gender-based violence. We had several dialogues in the area of Mtwalume and the aim of amplifying our strong message against the abuse of women. Under substance abuse prevention and rehabilitation, which is allocated 87.9 million, the budget of this program has been decreased by 5 million as well. Under the program 5, development and research, the department and research program remains a critical vehicle for assisting the department to step up the pace of the paradigm shift from social welfare to social development. To this end, the department will strengthen this program to create opportunities for more people to participate actively in community development issues that affect the lives of the people. With reductions in all our program caused by the pressures to fund COVID-19 pandemic, it becomes difficult and very difficult to implement our plans as indicated. The 2021 budget allocated for the development and research program has been reduced to 23.5 million rands, which make it very hard to breathe. The budget under the community mobilization, which is allocated 2.3 million, the budget is thus far. Under institutional capacity building and support, the budget is allocated, this sub-program is allocated 15.4 million. The budget has remained unchanged, fortunately. Under poverty alleviation, sustainable livelihood, this has been allocated 19.1 million that has been allocated for this sub-program and has remained unchanged, fortunately. One of the key interventions under this sub-program is the provision of nutritious food through community nutrition development centers. The budget allocated for community-based care, research and planning is 987,000. This will allow the department to continue with community-based care and research. Under youth development, the budget is allocated as 42.9 million rands. It has been reduced, unfortunately, by 10.3 million rands. It is a blow below the belt. Under women and development, the budget has been reduced by 1.617 million and remains at 10.3 million rands. Under population policy promotion, which is allocated 4.710 million rand, and it is not changed. Ladies and gentlemen, a total allocation of 3.7 billion is requested by the KwaZulu-Natal Social Development for the 2021. The amount has been cut, as we have alluded to, and we have moved from 3.8, which was cited early this year, to 3.7 billion rands. Honorable members, the COVID-19 pandemic, while it is a health issue, it has also created many socio-economic challenges for many individuals and families whose breadwinners have lost jobs and livelihood. We will forever be grateful to the NGOs, civil society formations, private sector, and individuals across the racial divide who offered a helping hand to the government during these difficult times. We have to be alive for the humiliating cries and suffering from continuous people, individuals. As such, we have moved with speed from social welfare to social development, and therefore we cannot allow the little resources to be gobbled and by corruption and financial mismanagement. We are looking forward towards the conclusion of the investigation on the irregularities. We commit ourselves to deal decisively with corruption, ensuring consequence management. Our department has embarked on the restructuring process, and we were quite aware that such a move that will have a different meaning to other people. However, it is the nature of human beings to resist change and opting for mendacious to protect the wrongs. There are a few fallacies by alarmists and opposition parties who want to create panic because they have something to hide or they do not have a full understanding of issues. I can assure you that there is no state of disarray in the department, but we need people employed by the government to be committed, loyal, and dedicated servants of the people. People have entrusted the ANC to work towards moving them out of the joblessness, poverty, and inequality. Therefore, nothing should remove us from the commitment we made with the people. We are grateful to the Honorable Premier, Mr. Sihle Zikalala, and the entire Provincial Executive Council for ensuring that we perform this duty to the best of our ability. Also, I pay my sincere gratitude to members.
Honorable MEC, your time is up.
Can you add a minute, 2 minutes?
No.
Also, I pay my...
From your time.
Thank you. Also, I pay my sincere gratitude to members of the Social Development Portfolio Committee for keeping us on toes all the time. The head of department, Mrs. Nelisiwe Vilakazi, came in just 3 months ago and has a responsibility to dose the fires as an accounting officer. We want services to reach our people, and we are lucky because she fully understands what needs to be done. We are grateful that the workforce of the department remains committed to the mandate to change the lives of the people. I would also like to thank all members of the public. Without your support and patience, we wouldn't not be able to deliver services. And we thank you, all members of the House, for your continuous support. I thank you, Chair.